EPL tendon is a significantly in EPL tendon injury is for significant importance because first is this tendon get disrupted by adhesion rupture, for which a repair is not possible and EIP transfer is indicated. Anyhow, in acute injuries also, the location of injury is important. If the injury happens below the MCP joint, the tendon itself is adherent to the adductor tendons. If it's below the MCP joint, distal to MCP joint, then the tendon is somewhere at the transverse carpal ligament dorsally. Anyhow, if it is acute, I plan to repair this tendon. Within 7 to 10 days, I can be able to repair it. If I do acute repair, the active range of motion exercises which are implicated in the flexor tendon injury as well as extensor tendon repair are not well appreciated in EPL injuries. If I'm not able to repair it or there is attrition rupture, then a tendon transfer is indicated. The reason being that vinculus are disrupted and there is no good optimal tendon for sutures fixation. For that reason, EIP transfer is indicated. EIP is transferred by 3 incision technique. The first incision is level of MCP joint of index finger. The second incision is just proximal to the transverse carpal ligament. And the third incision is at the level of the PIP joint. I will first of all do the tenotomy at the level of MCP joint for the EIP joint. Then give a small incision that transverse carpal ligament and retract the tendon from there. Then I'll make a tunnel for the EIP joint and transfer it till and attach to at the PIP level of the thumb.